Hello everyone, welcome back to my channel. My name is Judith and I am super excited to have you back. So today I'm going to talk about something that I find fascinating. So months ago, quite a while ago, I posted something on my Instagram about egg donation and I got tons of questions asking me about details, but I did not put out details because I wanted to be sure. I needed to confirm everything I was going to put out on my YouTube channel, because every information I put out on my channel is authentic. So now that I have quite good information for you, I am here to do a video. So if you want to know what's up, you know what time it is. Please stay tuned. Egg donation is basically when a woman gives her eggs, also known as ovum or ova plural, to another woman. So you know how blood donation is, where the person gives blood to another person. So it's the female version of sperm donation. I'm sure it's no longer news that men donate their sperms for little cash. Basically, egg donation and sperm donation is used to help infertile couples. So when a couple is having issues with fertility, of course they go to the doctor, they go to the gynecologist, and a series of tests are carried out to find out what is wrong, because it could come from the man, it could come from the woman. So assuming it's coming from the woman, they will also try to find out what exactly is the problem. Some people can fertilize their eggs, but they cannot carry their babies. These are the kind of women that are advised to go for surrogacy. And there are also women who generally cannot even fertilize eggs. They have the eggs that they can carry, but the whole process of fertilization cannot occur in them. And some other women do not even have eggs. Some women are born like they don't have eggs, while some get to menopause and they don't have like viable eggs anymore. Another set of women are women that have crossed maybe 35, or they're already in their 40s. They advise you to take eggs from a younger woman, because the older you get as a woman, the more likely your child is going to come down with congenital anomalies. Also, women who have genetic problems in their families that they're trying not to transmit to their children. Today I'm going to be focusing on the donor's perspective. Young women can donate their eggs for a little bit of financial gain. By the end of this video, I'm going to tell you where to go to if you want to donate your eggs and how much they will give you. So you will have to watch the end of this video to get that information. Mostly couples are advised to go for females that they do not know. Like, the donation is anonymous. You donate and the couple don't know you. They don't know you. They just get your eggs. It's just you and the doctor, just so that in the future you don't come back and you try to claim the child that they've trimmed. So that's why they do that. Basically, the process is you go to the hospital and you show interest that you are interested in donating your eggs. The doctor takes your details and they begin to carry out tests. They run tests on you. They will run tests that will most likely affect the child in the picture. They will run syphilis, they will run HIV, they will take your history, personal history, and your family history. So in your family history, they want to know if you have family history of diabetes, hypertension, madness, any possible disease or disorder that can be transmitted to the child. They will want to know that history. So then for personal history, they want to know if you have had a child before. So they mostly will choose a woman who has had a child before, because it's assumed that, okay, of course, then that means her eggs are viable. They also want to know any health challenges that you have generally. And mostly they like to go for women between the age of 20 to 29 thereabout, because that is like our reproductive peak as women. So whether we like it or not, colorism is a thing, and lighter skinned people in this part of the world are favored. While you are going for all those treatments, when they find you worthy and you are being selected, they give you drugs. I'm not going to call the name of drug because I don't want anybody abusing those drugs, but they give you drugs that are supposed to help you ovulate and release more eggs. So normally in a female's reproductive cycle, during her ovulation, she releases 1 egg every month. But they give you these drugs so that during your ovulation you can release more than 1 egg. Possibly you could release like 4 or 5 or so, so that they can get more than 1. You have to know your menstrual cycle, like from the beginning to the end. You have to know how many days it takes for your menstrual cycle to start all over again. So that's the only way they can know when you're ovulating. So that is a topic for another day. You have to learn that and keep records of your menstruation. Very important. So I think the most question I got that day was asking me whether it was taking the eggs was through surgery. No, taking the eggs is not through surgery. So from this picture, we can see the ultrasound probe inserted into the vagina. Then the aspiration needle goes through the wall of the vagina all the way to the ovary. The ovary is the storage house of the eggs. Then the follicles are the matured eggs. So we can see that the aspiration needle gets to the ovaries, and then there is a suction pump down there that is used to suck in the follicle. And then there is a collection tube. So when the suction pump sucks the follicle, it goes into the collection tube. It's that simple. They are going to use ultrasound guidance. I don't know if you have gone for ultrasound scan, you will see when they're checking your tummy and there's a TV. There's like a monitor where they are seeing everything. So while they are putting this probe into you, there's a monitor. It's the monitor that helps them know where they are in and where they are going to. So they monitor the probe through these things until they get what they want and they pull out. The possible complications of this process is maybe a little bleeding, infection in rare cases, and in really, really, really rare cases there can be infertility, or it's like 1 person in 1,000, only 1 woman in 1,000 women may come down with infertility because of this procedure. That is why you have to make sure that you go to a professional to do this for you. Me, I don't see it as a problem. I don't think it's a problem because a woman cannot use 1/100 of her eggs in her whole lifetime. We don't get to use that amount. We have so many eggs as a puberty, and by the time you go into menopause, you have not even used, not even quarter. I'm talking of 1/100. You've not used it. So instead of wasting it, if you can, which they are going to waste and just fibrose and stuff like that, you can help another woman who is infertile. First and foremost, you are making her happy. You're helping the family. Secondly, you have your little financial rewards, basically, and everybody goes home happy. The only disadvantage here is the moral aspect of it. Okay, some people don't like the idea that they have their children or their child with another person that they don't even know. But come to think of it, most of the couples that go for IVF are couples that have money. Okay, they're couples that are capable of taking care of this child. So you know that you're not giving your ovum to ritualists or people that will not be able to take care of the child. They are mostly rich people, so you know that your child is safe. So let's go to where to get this done. Basically, you can walk into any fertility clinic anywhere you are and ask them. Please try to walk into a good, like that, you know, that is good fertility clinic. Any clinic that calls itself fertility, they are involved in IVF. They're most likely going to be in need of eggs, and the financial reward in Nigeria is mostly ranges between 100,000 to 150,000, depending on where you are. But for every time you come for test, they'll give you maybe like 5 to 10k. like maybe like transport to make sure so that you can come back again. When next you come, they give you another 10k. So by the time the whole process is done, they give you 100k cash. They give you your remaining money. I would personally encourage egg donation, honestly. And someone has asked me if I've done it before. Honestly, I've not done it before, but there's a possibility I will do it in the future. I don't know yet, but I'm open to it. I'm very open to it. So thank you guys for staying up to this moment in this video. Please do not forget to like this video, share and subscribe, especially if it has helped you. Kindly share to other people, because I'm sure there are a lot of people that do not know that this thing exists and their eggs can actually save a family. Thank you guys. See you in another video. Bye.